My name is Krishna Patel, and I am the Director of Facial Plastic and Reconstructive Surgery. Our division, it's actually a really broad spectrum of surgeries that we actually cover.
One of the things I do a lot is facial paralysis treatment, so people who have facial paralysis from any cause. It's a pretty rare condition to have, and even rare to have people that kind of specialize in the whole treatment of that, including the kind of microvascular reconstruction of it. There's a few different procedures that can help reanimate a smile. Sometimes we can hook nerves together to get smile in your natural facial nerves. Sometimes we have to take muscle, like a muscle transplant from the leg, into the face to help people smile.
I do a lot of cleft lip and cleft palate surgery. Sometimes children are born without ears, and we do what's called microtia surgery, which is rebuilding ears. That's actually why I went into facial plastics, was because I really was passionate about taking care of children, and especially in the setting of being born with a cleft lip or palate. What's really amazing about it is that you actually take care of these children from the day they are born, sometimes even before, until they are adults. And there's something really beautiful about that.
The best thing that I like to hear from people is to say they go back out to a restaurant, go hang out with friends, and they're not self-conscious about eating in public, about being seen in public, because what we are doing for people is affecting their appearance and their face. That's how everyone sees you and knows you. So when you can restore that ability to just go out and live life, that's a big thing for a patient. That's what I love to hear.
It's not just about surgery, it's about taking care of every component of what they need, and I think we do an excellent job of that. We have great staff, very wonderful, supportive staff that help us make this possible.